Hey, everybody, I'm going to do a little. On consent. And then on bills on second reading, I have items 17, 18, and 19 on consent. Does anyone need to have any of those items pulled off the consent calendar? Let's see, council member Prepty, if I can find your name, I will be. Oh, now I see it. Councilmember Prepty, you're recognized.
Thank you, Madam Chair. You knew it was coming. If I could remove item number 14, RS 2024-509 from consent.
Okay, I've got that one. Thank you very much.
Thank you, Madam Chair.
Anyone else need to have any other items removed from the consent agenda? Okay, I will go ahead and read the consent agenda, and then if anybody has anything else that needs to come off, we will pull it off at that point. So first item on the consent agenda is number 2, RS 2024-483 by Porterfield, Bradford, and Evans, a resolution adopting a new pay plan for employees of the Metro Departments of Police and Fire effective July 1, 2024. Item number 3, RS 2024-484, Porterfield, Bradford, and Evans. Director Darby just brought up a really important point about re-referring back to committee. And so we're going to back up. We're going to take items number 2 and 3 off of consent so that way we can approve them and be re-referred back to committee. So moving forward, we'll skip ahead to item number 5 is where we're starting our consent agenda. RS 2024-495 by Porterfield and Evans, a resolution approving a contract between the Metro government of Nashville and Davidson County and Oklahoma State University, DBA Fire Protection Publications to provide International Fire Service Training Association training materials in print and digital form for the Nashville Fire Department. Item number 6, RS 2024-497 by Porterfield, Evans, and others, a resolution accepting a grant from the Tennessee Department of Health to the Metropolitan government, acting by and through the Metro Board of Health to provide the Tennessee Breast and Cervical Screening Program to offer individualized assistance to clients and to facilitate timely access to quality screening and diagnostics. Then item number 9, RS 2024-500 by Porterfield, Evans, and Welsh, a resolution accepting a grant from the Tennessee Department of Health to the Metro government, acting by and through the Metro Board of Health to prepare for, respond to, and recover from public health threats, including but not limited to the response and recovery from COVID-19 and Mpox outbreaks. Item number 10, RS 2024-501 by Porterfield and Evans, a resolution amending Resolution RS 2024-213 to correct an error in the description of a grant from the Centers for Disease Control and Prevention to the Metro government, acting by and through the Metro Board of Health. Item number 11, RS 2024-502 by Porterfield, Evans, and Welsh, a resolution approving amendments 3 and 4 to a Community Health Workers for Public Health Response and Resilient grant from the Centers for Disease Control and Prevention to the Metro government, acting by and through the Metro Board of Health to address COVID-19 health disparities in the Nashville area. Item number 12, RS 2024-503, Porterfield, Evans, Welsh, and others, a resolution approving Amendment 1 to a grant from the Tennessee Department of Health to the Metro government, acting by and through the Metro Board of Health to improve the health of citizens of Davidson County by preventing and controlling the use of tobacco and tobacco products. Item number 13, RS 2024-504 by Porterfield, Evans, Welsh, and others, a resolution accepting a grant from the Friends of Metro Animal Care and Control to the Metro government, acting by and through the Metro Board of Health to provide funding for emergency medical care, the safety net program, the foster program, and the rabies clinic for shelter animals. Item number 15, RS 2024-510, Porterfield and Evans, a resolution accepting the terms of a cooperative purchasing master agreement for motorcycle headset equipment and related public safety products for Metro Nashville Police Department. And then skipping over to bills on second reading, we have item number 17, BL 2024-378 by Porterfield and Evans, an ordinance granting the purchasing agent the authority to extend the term of contract number 458569 for the Fire Department Medical Services Billing and Collection Contract. Item number 18, BL 2024-379, Porterfield, Evans, and Ellis, an ordinance approving an amendment between Bethel University and the Metro Government of Nashville and Davidson County by and through the Metro Nashville Police Department to provide a reduced tuition rate to qualifying MNPD employees judge enrolling in Bethel's online degrees program. Item number 19, BL 2024-380, Porterfield, Evans, and others, an ordinance approving an agreement between the Nashville Police Activities League, Nashville PAL, and the Metro Government of Nashville and Davidson County by and through the Metro Nashville Police Department, or MNPD, to develop extracurricular activities for at-risk youth. Do I have a motion? All right, it's been moved and properly seconded. All those in favor of our consent agenda, please say aye. Anyone opposed? All right, thank you. We recommend approval. All right. Oh, okay. No, they're coming back here. Okay, so we recommended approval of all of our consent items, 7 in favor, 0 against, 0 not voting. Going back up to resolution number 2, RS 2024-483, Porterfield, Bradford, and Evans, a resolution adopting a new pay plan for employees of the Metro Departments of Police and Fire effective July 1, 2024. Do I have a motion? Okay, it's been moved, and we do need to re-refer it back to this committee for one meeting. So do I have a motion to defer it for one meeting? Okay, it's been moved and seconded. All those in favor? All right, 7 in favor, 0 against, 0 not voting. And then item number 3, RS 2024-484, Porterfield, Bradford, and Evans, a resolution adopting a new pay plan for employees of the Metro Board of Health effective July 1, 2024. Do I have a motion to defer and re-refer back to this committee? Okay, it's been moved and seconded. All those in favor? All right, thank you. Anyone opposed? All right, 7 in favor, 0 against, 0 not voting. Okay, item number 4, RS 2024-486 by Porterfield, Evans, and Welsh. That's going to be withdrawn. So we're skipping past that one. And then item number 7, RS 2024-498 by Porterfield and Evans, a resolution appropriating a total of $140,000 from the Metro Government of Nashville and Davidson County, acting by and through the Metro Department of Health to Research Foundation of the City University of New York, OBO National Network of Safe Communities, for the provision of strategic advising to key Nashville partners and stakeholders, including law enforcement, service providers, and community leaders to implement NNSC's group violence intervention. Do I have a motion? Okay, it's been moved and seconded. I took this one off consent because I thought a representative from Metro Health could come and kind of give a little bit of the commentary that you gave last night, since it was a topic during budget and finance. So I will invite you to the podium. And if you could introduce yourself for everybody in here.
Sure. Thank you. Kabera Leach, Chief Health Strategist, the Metro Public Health Department.
Thank you. And could you just give everybody some context around this one? Because I think there was some confusion amongst myself, other members of Budget and Finance about kind of where we are with the, we're basically authorizing payment and everything really late, but this is for something that was from last term.
Yeah, absolutely. So this agreement between the City University of New York through John Jay College was agreed upon in the last administration, and John Jay started doing the work. They have done the work. There is a report available, and a list of people that are involved in this was requested yesterday. I'll be able to have that in a week's time from now. The person who holds the report is actually out of the office on business for the department, but is out of the office. And when the administrations changed over and the work from the community safety office moved into the public health department, we realized that there was actually no contract for the work that had been done by John Jay, and they need to be paid because the work had been done. So what we are doing now, but by submitting this resolution, is asking for permission to execute the contract on the funds that were approved in the last session for the $140,000.
Thank you. And then the report that is going to be coming our way, I thought there was some good conversation yesterday about like what a group violence interruption program is. Does it get into that level of detail as far as kind of giving context for anybody on the committee that may be reading it later?
It may. I haven't seen the report myself. However, that information outside of that report can be made available to you because there's lots of documentation and research on what that entails.
Thank you. Anybody have any questions on this particular resolution? All right, thank you very much. Anyone wanting to renew this motion, please? All right, thank you. It's been moved and seconded. All those in favor? Anyone opposed? Anyone not voting? You're not voting? Thank you. All right, 7 in favor, 0 against, 1 not voting. Okay, next resolution that I pulled off consent, RS 2024-499, Porterfield, Evans, Welsh, and Allen. A resolution accepting a grant from the National Association of County and City Health Officials, or NACHO, to the Metro government acting by and through the Metro Board of Health for youth and community violence prevention action teams to support new and or existing youth and community violence prevention. Do I have a motion? Okay, it's been moved and seconded. I wanted to pull this off for just a little bit of discussion because this is something that I'm involved with as one of the action team members. And so basically what this particular program is, I think the resolution to be able to execute and accept this grant is coming a little late in the process because we only have about 6 or 7 more weeks kind of left of this project team. But essentially what it is, it's a convening to kind of essentially reset some of the conversation around violence in our cities, and then also what are some actionable steps, that we can take as a city to be able to address some of those violent situations, and also, what are some of the preventative steps. So as part of that process, I attended a convening in Denver, Colorado. Denver was the host city, and we heard a lot of different presentations from cities around the country, how they're addressing different issues. Everybody's experiencing the same problems, and so that was a takeaway. But then also some cities have some really innovative approaches in some things that they're doing. In particular, Denver had some really interesting things that they were doing around gangs and some of the gang interruption work. And so there'll be some kind of report that'll come out of this process that will be shared with everybody in here and the rest of the council, but just wanted to add my commentary around it. I don't really know why it is coming to us so late, but I also know that I spoke to NACHO specifically about kind of this acceptance, and if they can get it, if we can get it executed and not deferred or anything like that, which I don't think will happen, we'll actually have a little bit of extra money that will come our way as part of the grant. So just wanted to give you all that information as well. Anybody have any questions about this one for Metro Health or me? Okay. Can anybody renew this motion, please? All right. It's been moved and seconded. All those in favor? Anyone opposed? All right. So this time it is 8 in favor, 0 against, and 0 not voting. All right, we will skip to item number 14, RS 2024-509, Porterfield and Evans, a resolution accepting a Project Safe Neighborhood or PSN grant from the Tennessee Department of Finance and Administration, Office of Criminal Justice Programs to the Metro government, acting by and through the Metro Nashville Police Department to reduce gun-related violence in Nashville by providing funding for overtime for the investigation of violent crimes involving guns. Do I have a motion? All right, it's been moved and properly seconded. Do we have any discussion? All right, Councilmember Prep-T, you are recognized.
Thank you, Madam Chair. I just wanted to ask Chief, pose a question through the chair to Deputy Chief Gilder about a number of things that I was just a little bit curious about. So, over the past couple of weeks, unfortunately, Nashville has experienced a great number of incidences of gun violence, and so one of the things that MNPD talked about as it related to within one of their press releases, within one of the investigations, was a partnership with one of our federal agencies that are present here in Nashville, the ATF. I was just wondering if Chief Gilder could speak to the partnerships that we have and what resources MNPD has available through joint cooperation with our various federal agencies for the investigation of violent crimes that involve firearms.
Thank you. Deputy Chief Gilder, you're recognized.
Thank you. Yes, we're lucky and fortunate to have good partnerships with our federal partners. We work with the U.S. Attorney's Office here in Nashville on PSN cases, Project Safe Neighborhood cases. So when you have individuals that are causing harm in communities that are convicted, usually they have multiple convictions of firearms offenses, and they're caught with a firearm. That is something the U.S. Attorney's Office will review for federal prosecution. We work closely with ATF. We have ATF, we're a member of their task force. They work hand in hand with our Titans unit, which is what this legislation would fund overtime for. For those of you that don't know, this is the neighborhood, the group that addresses neighborhood shootings. So they investigate both lethal and non-lethal shootings, and this fund is solely going towards overtime work for them. And so they're going after those folks that are out there pulling triggers in the community, committing aggravated assaults and homicides. They've been very effective in what they do. They do a lot of work, whether it's canvassing neighborhoods, following incidents, and making leads, collecting shell casings, put them in through NIBIN, which is the national database. It's kind of like a fingerprint for firearms casings. We belong in a partnership there, and can make identifications that way. And they've been pretty effective. And year to date, we are down currently 20% on homicides, and we're down year to date 10% on aggravated assaults.
Thank you. Councilmember Prep-T, do you have additional questions?
I do. Thank you, Madam Chair. Again, posing a question through the chair. Just for clarification, the Titans unit, is that under the SID, the Special Investigations Division?
That's correct.
And then, Chief Gilder, could you also talk about what resources are available through MNPD to the community with regards to gun safety, whether or not there are any sort of just what resources the community can seek if they own and possess a firearm, like what resources are available through MNPD? Sure.
So our community coordinators, we do a lot of community meetings. And that is one of the things that we talk about is gun safety and encouraging gun owners, both one, to secure firearms safely, not leaving them in your car, accessible to thieves and that sort of thing. Gun locks, we do have a program where we provide free gun locks. There's groups that we work with that donate gun locks, and we will in turn provide those. So if some people are interested, they can contact their precinct to learn how to obtain a free gun lock. And then we encourage folks to get trained. There's a myriad of resources that are available here locally that do good firearms training. And so if someone is going to own a firearm, then that's something we always encourage them to be well trained.
Councilmember Prep-T.
Yes, I just wanted to piggyback off of what Chief Gilder just said and encourage those of us in the community who own and possess firearms that we need to be conscientious of how we own and possess those, making sure that we're doing those within reasonableness and making sure that we are securing our firearms, like Chief Gilder said, not leaving them in our vehicles, making sure that they are secured, making sure that not only secured whenever you're traveling, but also within your homes. Gun deaths are the #1 killer of children in the United States right now, which is a disheartening statistic. It is also the number one source through which people die by suicide. So just wanted to encourage our community, one, not only to store and possess firearms responsibly, but if you are struggling with mental health and you have access to a firearm, I would encourage you to secure those with a person that you trust, but also seek resources that, because if you're struggling with your mental health, you're not alone in that, and you don't need to feel alone. So thank you, Madam Chair.
Yes, thank you, Councilmember Prepty, for that message, and thank you, Deputy Chief Gilder. How about any other questions on this particular item? All right, can someone renew this motion, please? All right, it's been renewed, properly seconded. All those in favor?
Aye.
Anyone opposed? Anyone not voting? All right, we recommend approval. Okay, then we're going to go down to our late filed resolution. The purpose or the ideal situation with this resolution is that we're going to defer it for one meeting. So I'll take some questions on it, but we also have a guest. So I want to make sure that we're mindful of that. So this is late filed resolution by Porterfield, a resolution approving amendment number 1 to contract number 6488663 between the Metro government and Axon Enterprise Incorporated. Do we have a motion? It's been moved and seconded. Do we have discussion? All right, see Councilmember Huffman first, and then we'll go to Councilmember Prepty.
Thank you, Chair. And before I get started, just as a point of order, do you need a deferral motion made before I start, or can I just go through my questions?
I think you can go through your questions first, and then we'll
Okay.
pick that up.
Thank you. Oh, and I see the Deputy Chief walking up. So just a few points of clarification for you, Deputy Chief Gilder. The first is in regards to the sound between the T7 and the T10. Could you describe just the difference between the two?
Sure. So the T7 makes a louder kind of pop sound when it's deployed, when the probes are deployed. And the T10 is the deployment is much quieter than the sound that you would get from the T7.
In your professional opinion, do you think that the T7 could be mistaken for a gunshot potentially?
I would say that there have been claims around the country that people either thought maybe a suspect or another officer mistook the sound of a taser deployment for gunfire. And I think certainly having a quieter, sound when it goes off, it certainly would help abate that happening. I mean, I don't know that we've experienced that here, but that I've certainly heard that discussion before.
Sure, and God willing, we won't. But it's the if that I'm interested in. So thank you for that. Also, and I'm going to run through just a series of comparisons here. The next one is around the distance between the 7 and the 10. Could you just give us a general overview?
Sure. So the Taser 7 has an effective range of 22 feet, which is the model we currently carry. The Taser 10, which is what we're seeking to obtain, has an effective range of up to 45 feet. And that's important for a couple of reasons, primarily because officers don't have to get as close to the subject. It's safer for officers and the subject. It provides one of the things that we teach and we train officers is in de-escalation is distance is your friend. The closer you are to someone, the more threatened that person may feel. And plus the reactionary gap is you're provided more time to react if somebody, goes to attack you. So the distance is always a good thing when we're encountering someone who's hostile that may be resisting arrest. So effectively doubling that range of the taser is a huge deal to us.
Councilmember Huffman, let me
Yes.
interject and
Yes,
just
sure.
can I give you one more question? Let me transition to Councilmember Prepty.
Absolutely,
Okay,
yeah.
thank you.
My last question for you is more around the ease of use between the 7 and the 10.
Sure.
Could you talk about just the difference between the prongs and the 10 individual darts?
Yeah, and I'll be succinct, or try. So the Taser 7 works like all the tasers up till now, deployed 2 darts at the same time. So you're having to aim for 2 places on the body at the same time and hope that both of them hit, because if they don't, you're not going to get incapacitation. The Taser 10, and if you miss with the 7, you do have 1 extra set of darts that are on the device, but the way it's set up is one set of darts is for close range because they spread apart, and one is for further back, so they won't spread as much. With the Taser 10, they're all deployable. You can deploy them from point blank all the way out to the 44 feet. If you miss one, there's 9 other darts on there. So you got a chance to make connection, and you're not having to aim for 2 places on the body at the same time. You deploy the darts separately, and that's a big deal because oftentimes we encounter people that are wearing thick clothing, or we don't have good, because there's only certain places in the body that are acceptable to target with the probes. And so this gives you a better chance of getting an effective contact with 2 probes and getting that incapacitation.
Just one more question. I'm sorry. It's just a quick follow-up for you, Chair. I will hurry. With the 7, can you talk about when you pull it out of the holster and the positioning that you have to do to realign the lasers, just for everybody to hear?
Yeah, so it's got 2 aiming dots, which is helpful in that you get an idea of where the 2 probes are going to go, but you're having to watch 2 targets at the same time. And if you are changing the distance on the darts, if you're changing from the close darts to the far away darts, then that changes the laser dots and rechanges your focus. The Taser 10, the dot is the dot. Where you put the dot is where the probe is going to go. So you got 1 point of aim, and it's much easier, especially under stress.
All right, thank you, Councilmember Huffman. Councilmember Proti.
Thank you, Madam Chair, and I'll be very quick with my questions. With the Taser 10, with the service belt that field officers currently wear, my understanding is that the Taser 7 is in a location sort of on the left side of their body. Is there any size difference between the Taser 7 and the Taser 10 that will change the positioning of where that would be on an officer's utility belt?
I don't have the exact measurements of the 2 devices. I will say from handling both of them, they're fairly similar in size, so I don't think that's going to be a huge difference. We, by policy, mandate that officers carry their taser in a cross-draw position, which is what you're referring to. So if I'm right-handed and I carry my pistol on my right side, my taser has to be deployed on my left side, and the opposite for left-handed people. And that is to avoid any issues with weapon confusion. So under stress, you don't want someone grabbing for what they think is their taser, and instead they grab a pistol. Your mind's having to do more work when you're reaching across your body to draw that taser.
Thank you, Chief Gilder. And then one more question is following up on what Councilmember Huffman was saying with the potential of mistaking the deployment of a taser with a gunshot. Are MNPD officers trained to verbally articulate whenever they're deploying, essentially like seeing what we've seen online of videos of officers being like taser, 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 and then deploying? Our MNPD officers trained to do something similar?
Yes, sir. They, by policy, when they can, when it's feasible, they are to announce taser, taser, taser. And that's not for the subject as much as it is for the fellow officers that are there, so they understand that a taser is being deployed. They know what it is, and then also so that they're out of the way and don't accidentally get struck by any of the probes.
Thank you. And then, Madam Chair, just by way of making sure that we're clear on the procedure that we have before us, I'm going to renew the motion for a 1 meeting deferral with a re-referral back to committee.
I'd like to pick up Commander Nash's question real quick, if we can do that.
Yes.
Can we come back to you?
By all means.
Commander?
Madam Chairman, thank you. In the last discussion of the tasers, the new tasers, there was a lot of confusion and supposition that the police department's changing these out every 2 years. And I wonder if Chief Gilder might be able to kind of explain how long we had the first tasers, why we switched, and then we learned of the newer model so that we're not wasting money on old technology.
Sure, we can take that question. And then after that, I'll go back to Councilmember Proti. Commander?
Thank you.
Or Deputy Chief.
It's okay. So prior to adopting the Taser 7s in 2022, we have been carrying the X26s since about 2014. The Taser 7s have been out for a number of years. I think, I don't want to get the date wrong, but I want to say around 2019-ish, the 7s had come out. We were still carrying the 26s. We were getting to the end of life we were starting to have more issues and paying more to get those repaired and then whatnot. Yeah. And so, that's when we transitioned to the 7s. And, I realized that 2022 is not that long ago. We're 2 years into this contract. But like I said before, and I think you referenced, the leap in the technology and the advances in the safety for both the officers and citizen are just astronomical. This isn't a simple upgrade of a second aiming dot or an extra pair of cartridges on the device. You're not having to change a cartridge like we changed between the 26 and the X26 and the 7. This is a huge leap. And that's why we just believe the safety of it is paramount. And that's why we think this is an appropriate move.
Councilmember Nash?
Yeah, so just to be clear, the first set of tasers we had for 8 years.
Yes.
And as they started being phased out, so to speak, you need to upgrade. We went to the 7, not knowing that just around the corner, this far superior taser was going to be available. We haven't spent all the money on the 7s. That's correct?
This is an amendment to the 7
Right.
contract.
We're trying to use that money now going forward with the 10.
Thank you, Councilmember Nash. All right, I will go back to Councilmember Prepty for a motion.
Thank you, Madam Chair. I've just wanted to note that we have a number of committee members who are not present here today. I just want to make sure that we have adequate opportunity for the entirety of this committee to get their questions answered. So with that, I will move to defer this item 1 meeting with a re-referral back to committee.
Thank you. We've got a motion. Do we have a second? Thank you. All those in favor of a deferral for 1 meeting with a re-referral back to Public Health and Safety, please say aye.
Aye.
Anyone opposed? Anyone not voting? All right. Thank you. Recommend approval of a deferral. Okay. With that concludes our agenda items. We are going to invite our guests to come forward. We have Judge Melissa Blackburn, who's going to speak to us about Nashville's competency and well-being docket. You're welcome to come up here to use your presentation and
button right there, and you should be good to go. Okay, thank you. Okay, let's click on which? Just this button right there. Okay, thank you. If you want to test it out, just to make sure you can.
Good, thank you. Okay. Thank you all for having me. We began Nashville's competency and well-being docket in 2022. It began as a result of an incident that occurred April 16th of 21. There was a gentleman who came through St. Thomas Midtown. His name was Larry Brown. He made the national news. He attacked 5 nurses that were going to work that day in the elevator and injured them. And because he did make the national news, that's the reason I can use his name. But I sat down with the DA, the public defender, and we all decided something had to change. His cases were nollied for injuring those 5 nurses, which meant those cases were dismissed. 2 weeks later, he was rearrested. Those cases were nollied as well because Mr. Brown is incompetent. So Mr. Brown is injuring people time and time again, but yet his cases are being nollied. That's a problem. He's a danger to himself and to others, but yet his cases were being nollied. So we put together a group of mental health professionals in Davidson County, and over a year's time, we worked to come up with a solution. What we thought was a solution as to how we could address this problem. What we didn't know at that point was that there were 182 people in Davidson County that had been deemed incompetent. And I'm sorry, I'm getting ahead of my slides. I'm used to talking without slides, but that's what these slides are saying, so I apologize. Would you, somebody else usually does this for me, I'm sorry. So I'm talking way ahead of the slides. And what occurred is over that year, we all sat down and came up with a plan. The Mental Health Co-op, Centerstone, Park Center, MTMHI, everyone that deals with these individuals that have mental health issues in Davidson County. We all put our heads together, and the DA, the public defender, and tried to figure out exactly what we could do. And what we came up with was a program that we presented to the mayor, and that was what the mental health, this competency docket or incompetency docket is. And it found that the heaviest burden is for those that are already marginalized and underserved in our population. 53.2% are African American, 40% are African American men, nearly 1.5 times that of white men. Almost 13% are African American women, nearly 1.3 times that of white women, and 61% of this population are experiencing homelessness. So these are really the most needy individuals in our society. That's who's coming through this incompetency docket. These are the people that need more services than anybody else in Davidson County, and these are the most dangerous individuals in Davidson County. 60% of the current population were anticipated to be rearrested within 90 days and experience arrest at more than twice the rate of individuals who are competent to stand trial. Now understand, because they're incompetent, their charges are going to be nollied and they're going to be released back to the street. The average wait time for a 30-day evaluation at MTMHI is 60 days. The good news, though, is they're waiting in jail for that evaluation. So they're safe, they're fed, and they're housed. Although sometimes it may be as long as 90 days. Without additional options for restoration and connections to care and services, these individuals cycle through the adjudication process and criminal justice system. 71% of this population had a primary diagnosis of psychotic symptoms. 42% had a primary psychotic disorder, schizophrenia, delusional disorder. 21% had a mixed psychotic and mood disorder, bipolar disorder with psychotic features. 75% also had a substance abuse diagnosis. And I think that's low. I would say that probably closer to 90%. In response to these findings, we convened the task force, which I spoke about, and representatives from the mayor's office, the district attorney's office, the public defender's office, mental health court, and community partners. And we worked over a year to put this together. The result was the competency and well-being docket, which we started in October of 22. It was a pilot program to make an attempt to respond to the cases that had previously had their charges dismissed, and they were released back out into the community to commit more crimes and further endanger public safety. In partnership with the Mental Health Cooperative and with a $600,000 grant from the Cooper administration, this first competency and well-being docket was funded. It serves individuals with misdemeanors who are deemed incompetent to stand trial. It is the only docket of its kind in the state, and it will complete its second year in July. We believe it's also the only kind in the country. Since October of 22, the competency docket has adjudicated 117 cases involving 101 defendants. The population experiences a high rate of serious and persistent mental illness. 74% of the 87 cases, 56 of these cases, or 64%, have a co-occurring disorder. The program's budget covers a program manager who is a licensed clinical social worker who represents about 20% of our total funds. The program manager coordinates mental health services prior to release and supports transitions from custody to inpatient and back to custody and release. Without her, we could not operate. The remaining balance of program funds reflect the cost of competency restoration and other services and supports for individuals on the docket, largely to support their participation and their defense and due process rights. The court is grateful to Mayor O'Connell for continuing this funding in the proposed 25 budget. The Davidson County General Sessions Court proposes to enhance the capacity of the competency docket program to swiftly assess cases, prioritize complexity, both mental health, acuity, and public safety risk, and eliminate unnecessary incarceration through the connection to population-relevant care, pathways in housing, so that individuals remain in the community and no longer interact with the justice system or experience unnecessary psychiatric hospitalizations. We've applied for a Department of Justice grant to increase housing capacity for this particular population. That's one of our biggest needs, is supported housing. The docket program partners need actionable data to determine what works best for the individuals on this competency docket. Actionable data will help the court and its partners determine what clinical and legal decisions can set these individuals on a path of stability and recovery outside of the criminal justice system. Once actionable data is in place, the court aims to pilot new services such as intensive case management to support individuals in the community and in new housing opportunities. The court is requesting from the council $75,000 to build the capacity to capture, analyze, and report actionable data. Right now, my administrative assistant is the one keeping up with the statistics. And I don't know if you've ever had an administrative assistant. She's a fabulous aide, but she does not keep up with statistics. She can keep up with everything under the sun, but not statistics. She's a jewel, but not statistics. I want to thank Councilmember Evans and thank the committee members for your consideration. And if I have time, I'm happy to answer any questions.
Perfect. Thank you very much. I guess I have a question just to kind of kick us off. So as far as the wish list item, the $75,000, can you speak to the committee about really the impact of the Gillian Ludwig law and kind of what that looks like why you're having to reconvene people back together related to, what's passed at the state?
Well, that law is a godsend, let me tell you this, because what that has done is that is now allowing the state to be responsible for paying for further evaluations at MTMHI. That has not happened in the last 10 years. For the last 10 years, if we wanted a further evaluation, Metro was responsible for paying for them. We had, all across the state, the counties were responsible for paying for further evaluations for misdemeanors. This is the first time it's ever happened, but the state this year will now, beginning July 1st, pay for those further evaluations for misdemeanors. So what we will be able to do with the $600,000, it will be able to use it to pay for further training, which is part of our program and part of what Vanderbilt says some individuals need. And we will be able to pay for some supported housing, which is something else we need to start doing. Those are two things that were recommended in the year-long study that we've gotten to a point in our program we need to do and have not had funds prior to be able to do, but will be able to begin doing this year.
And can you explain to everybody what training is? Because like when I hear training, I think of like, it's a classroom situation. Everybody's coming together and that kind of thing. But I know in the context, it could mean something different. Could you explain more of that?
One-on-one training by a psychologist training an individual as to how to work in society, just to be able to perform natural functions in society and to operate in society. These are not individuals that are DIDS individuals that have that low of an IQ, but they have an inability to be able to work in society in a normal fashion. And so it would be working with a psychiatrist or a psychologist to help them learn how to function normally in society. And we've had several individuals trained, but Vanderbilt has done the training, and Vanderbilt cannot do the training. We're going to have to put out a bid process to have another agency come do the training, because Vanderbilt would be the evaluating agency to determine if they've gained competency. So an independent third party is going to have to do the training, and then Vanderbilt's going to need to evaluate them to determine whether they've gained competency or not.
Thank you for that explanation. And so just to make sure that I'm understanding, so the $600,000 that you're currently allocated in your budget, that money really is for services of the people that are going through this process. And then the $75,000 that you're asking for as part of this committee and other council members' wish list really is around kind of the pulling together all the stakeholders, digging into the data and starting to build that story that's longer term in relation to how the state law has passed and what the potential impact is for the city.
Yes, absolutely.
All right, I'll take any other questions. Recognize Councilmember Nash.
Thank you, Chairman. Thank you, Judge, for being here and outlining your program. It seems to me that there's an awful lot of people working right now in this mental health space. We have mental health co-op, police department works with them, try to get people into right treatment. We have the Office of Housing that is working to get people some mental health support and in housing. And we've been working together with these two groups that come to mind immediately, as well as the health department, where some of this work can probably be done already. And it seems like there should be an awful lot of data out there already.
There is no repository in Davidson County for the data. That disappeared during COVID when the individual that was keeping the data statistics at the health department moved to Paris, France.
Exactly what data are you looking for?
There was data previously being kept on individuals in the jail. There was data being kept on individuals at the that were being seen by the mental health co-op and by the jail and by mental health court, because all these individuals intersect. And we're all seeing similar individuals at different times. Well, all of that information has disappeared and no one is keeping it. And we're not working together any longer because the individual that should be doing it at the health department, that position was not filled by our mayor. I specifically asked him. He said, you know, I did see that on their request, but I didn't fill that position.
Councilmember Nash.
And so, so you're going to fill that position at your office outside of Health Department?
So that we're going to have someone doing those statistics because we desperately have to keep those statistics
Sure.
so we can figure out how we best serve this population.
Thank you.
Yeah, because I guess, Councilmember Nash, from my perspective, hearing about this, because I've had a couple, meeting with Judge Blackburn and hearing more information about this, to your point, it's not currently being aggregated. It's disaggregated from information, if it's being kept up with at all, because of losing that position. And I think the other thing to consider is, in the mayor's office, we have 2 vacancies that I think are really key, health policy and a safety policy person that we had under Mayor Cooper. We do not have currently under this administration. And so there's not one person trying to convene all of these folks together. And so Judge Blackburn is working to try to pull people back together so that way we could get the ball rolling on doing this again, because we can't wait. We're in a position, where we need to kind of force the issue a little bit, if that makes sense. How about any other questions? Councilmember Porterfield, you're recognized.
Thank you, Chair and Judge. Thank you for that comprehensive presentation. I just had a quick point of clarity. It's kind of following up from Councilmember Nash's question. I understand this person is going to, I guess, bring these, different entities together. What is the data that they're collecting? I think that's the part that we're a little unclear about when you're mentioning is collecting data from individuals.
Well, like I'm talking about that we found out there were 182 individuals that were incompetent that we found within an 18-month period when we started this. Well, we've got to track and see where those 182 individuals were. Are they coming through the system again? Are they being rearrested? Are they being seen by MTMHI? Are they being seen by the co-op or Centerstone? Are they being rearrested? All these different intersects and how that affects their health, their position, and what do we do to better serve them? How do we keep them from being rearrested? I mean, the whole purpose of this, Council Lady, is to keep individuals from being rearrested and to try to give them the supported housing, the medication, the support, whatever we need to do, and try to change their life earlier in life and change that trajectory so they don't end up with us now at this point in their life. And we're trying to do that by the information we have now so we can look back.
Perfect. Thank you. That helped bring some clarity to it. It sounds almost like a social work position. Like are they going to be tracking the individual?
It is a statistician, though. It's someone that specifically handles statistics and understands how they get them, how they use them, and what they do with them once they have them. It's something I would never be able to do because that's not what my brain does.
I understand. So one more follow-up question. So if we're tracking individuals and let's say 150 people are incompetent, of that 50 people need like some type of med service or medication, or 30 people need job training or something. Is there then like the next step of like who then makes sure that they are tied into like mental health co-op to get med treatment?
That's the whole purpose. And then we'll coordinate with the co-op. You coordinate with Centerstone. You coordinate with MTMHI. And then you also put the services in with those so that we make certain we all keep up with those people and all those things occur. And that's because we're not talking to each other right now. Those things aren't occurring.
So what we're trying to figure out is the statistician being the person to connect the individual with the service, the wraparound services that they need, or you have someone collecting data, the person needs to get to this service. What's the bridge? Like, how do they get to the service?
It would be each of us having MOUs where we can each use the data that that person collects, so we can see the data that we each have and can work with each other based on that data to provide those services to each other.
Okay, perfect. Thank you. And
It's
then,
MOUs that do that.
perfect. And Chair, one more question, and I apologize because this is kind of going into budget a little bit, but since this is, I think that's maybe your intent, Chair, since we are talking about a wish list item here. Has there been any conversation of each of these entities maybe putting in on getting this person so that it's not completely you having to fund it from your department? Like if it's other departments that are going to be like benefiting from this position, can other departments also like maybe put in towards
I've
it?
talked at length with one of the doctors at the health department about it.
Okay, thank you. I appreciate it. Were they receptive? Are they
Oh,
saying?
absolutely, because right now the health department is farming it out to the state of Tennessee, and we've had the discussion that the state of Tennessee will then have the information, and the health department will lose the information and not house that information any longer. And that's a huge problem because we have to make sure that we have the information and use of the information. Like Vanderbilt, if Vanderbilt has the information, you never get the information again. They take it away and you have no use of the information. And that's what's going to happen with the state. So we have to make sure that we own the information and can each use the information. And by having the MOU with each other, we can do that. And working with the health department, Nashville owns the information. And that's why it's so important that the information reside at the health department. And we work together that way.
So then would it make sense to fund this position through the health department? Or would it make sense for maybe the health department puts in 20,000 and your department puts in 20,000 and another department puts in 20,000 if multiple entities are benefiting from the position?
Right now, my department needs to do this to get my stuff done because the health department needs to worry about getting their ship righted and funding their position and getting the mayor to fund their position.
Okay,
Because then my person can talk to their person and we can all get on the same page.
perfect, thank you. And a couple of the other, we had some other committee members that had questions and they had to go into another committee. So they just wanted me to let you know that some of the other council members will be following up with you directly with questions.
I'm happy to answer any questions.
Okay, thank you, Chair.
Thanks, Councilmember Porterfield. Let me get Councilmember Huffman, and then I think we'll be wrapping it up.
I think my colleague may have, I don't know.
Oh, I'm
Oh.
sorry. Councilmember Gregg, let me get you.
Thank you, Madam Chair and Judge. Thank you for being here. I just want to echo the importance of data. And for someone who may not work in the mental health field, they may be scratching their head going, And what I want to emphasize here, with each type of mental health need, there's specific interventions that need to happen to give that person the relief they need. In this case, when we're dealing with competency, that's a very unique skill set that we're trying to rehabilitate these individuals back into society. So the reason why you need this data is because your need is very specific. You're not trying to figure out an assessment tool or interventions for addiction. It's for competency. And so I just want to share with my colleagues the need and why this particular position is important to your department. Thank you.
Thank you.
Yeah, thanks, Councilmember Gregg. And Councilmember Huffman, I'll get you as the last person, and then we'll wrap it up.
Thank you, Chair, and thank you, Judge, for this presentation. It's been very informative. I have in my day job, I work in data analytics, so you're hitting a passion of mine here. I'm just a couple of questions. One with the MOU that you speak of. Do you know if there's any sort of data sharing agreement in there as well? I ask that just because I assume that there is protected data in there, such as people's names, date of birth, social security number, all that.
There used to be a data sharing agreement between the health department, the co-op, the police department, and the mental health court. There is not one currently because it expired. But there would this person at the health department, this position get filled, my position get filled, there would absolutely positively be another one put in place because we're all sharing the same bodies. And we all have to talk about these bodies and where they are and what they're doing. So there absolutely would be.
Okay, thank you. In regards to the tool that the statistician would be utilizing, obviously we may not know what that is right now, whether that's a tool like Power BI or Tableau.
That's beyond my
Right.
skill set.
Yeah. That not what I'm getting at. I understand we're still early in that process. I guess I'm curious to the example that you gave before. You had a person that left for, I forget where you said now, somewhere in Europe, right? Moved in, Paris, France, somewhere. Okay, so what are there going to be any parameters put in to prevent that, or to have some sort of fail-safe as a backup in case the future statistician runs off and leaves, locks all the data up? Just want to make
Absolutely.
Okay.
Because I will tell you, that happened at my husband's office the first week of December. He's an attorney who is practicing now at his 52nd year here in Nashville, and it happened at his office. And I spent 2 weeks at Christmas calling his vendors, asking them to please help us turn everything back on for him. So absolutely, there will be.
Great, thank you.
Thank you, Councilmember Huffman. So anyway, I'll just reiterate that if you're looking for a wish list item, this is a very worthwhile wish list item. I'm happy to send some supporting follow-up information through the council office so that way you can read it. But I think it'd be a really good use of taxpayer dollars to make sure that we kind of get on a better path, especially in light of the state law that was passed. And thank you very much, Judge Blackburn, for coming today and speaking. I greatly appreciate it. And then the last thing I wanted to say before we adjourn, of course, we had a lot of things happening over the last week. We had the tragic shooting deaths in Bellevue that speaks to, youth violence issues in our county, which are really significant. And then also we had, of course, the Community Review Board and the allegations against MNPD. So I just wanted to publicly say that I'm very appreciative that the mayor decided to use a third party to be able to investigate the allegations, so that way we could make sure we have some official, trustworthy transparency as part of the process. And so I don't know what our role as a committee will play as far as if we get to the point where there's something to review, but I just wanted to tell everybody who may be listening that I will always do my best to make sure that I am delivering transparent information about the process as I am chair. So that's all I wanted to say. Do we have a motion to adjourn? All right, thank you. We're adjourned.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information on this and other programs, visit nashville.gov.